welcome everybody. I am going to be going live and chatting with Lizanne, who is a director at Vigilant Fertility Clinic in South Africa. And we have some incredible, very important topics to discuss today. Hello, welcome. Someone has just said that Vigilant is their favourite fertility clinic, so we want to hear more about you and the clinic and ultimately everything around attachment theories that we're going to be discussing today.
All right, I'm also been an infertility patient myself. You know, I had tuberculosis, picking up from the uterus those days in the hospitals, and I had 3 abnormal miscarriages between my children. And so fertility is for me very important. My background is psychology. I've got a master's and I studied the psychological aspects of the fertility patients. So it's a passion what I'm doing. At the moment, I'm the director of Vigilant Fertility, and we are quite a big team of 22 people that's working here, and that's what we're doing. That's our main thing. So that's me.
I love the psychological approach that you take, because it can be overlooked in the medical field, and obviously the psychological impacts of dealing with fertility or infertility is extremely hard. So I've got some questions I'd love to ask you, and if anyone else wants to ask some questions to Lizanne, then please do as we go. The first one is, how do you get psychological closure when you're struggling with fertility or infertility?
Yeah, we all know that when you go through fertility treatment, it's a grieving process, and there's different stages of that. But when you come to the final decision that maybe that's the end of my road and maybe the end of my own biological path, that then you needed to get closure. And I think that's for me very important before you go with any other treatments or decided to use donors, conceive gametes. I think it's important that we talk about the closure, because I think we oversee it sometimes. It's a time where we really acknowledge our patients' feelings, because the meaning of closure means that they're letting go of what once was, and it's important that we also let them do that. I think it's a psychological process, as I said, and that's for me really important, because you've been traumatized by the fact that I've been diagnosed finally that it won't be possible to have my own child. And then we also help them to reframe parenthood. What is the meaning of family? So we can talk about that. And then we set them go home and think about it and come back. And when you're ready, then we can start to talk about donors. So that's for me really important, to have that session before we go ahead with donor conceived children.
Do patients at your clinic get emotional support alongside their fertility treatment?
Yeah, we use a biopsychosocial model here. So before our patients start with IVF treatment, all our counselors will sit with them and take them through the process. We guide them. We're talking about the risk factors. What is the risk factors? Anxiety, depression is one of the psychological risk factors. We talk about your thought processes, how to handle that intrusive thoughts that suddenly cross your mind and you can't get rid of that. And then also, how can you protect yourself? What is the resilience? What can you use, to make this treatment plan for you better? And what is your happiness spaces? So I think it's really important. Some of our patients even don't know that medication have a huge impact on your psychological status, the risk factors. So we guide them, and I think if you give them information and they understand directly how you work in your team, that's a fantastic option, that they not Google or, be certain what is the next phase and what we're going to do. We even give them a chance to talk to our embryologist to explain what's going to happen in the lab, and I think that's also important for them.
Brilliant. That sounds like really good support. And really, invaluable support that people need, especially at such a hugely emotional time.
Yeah.
And you have to make some really big decisions that you may not have been prepared to make or thought you would need to make. And for people who might be thinking about donor conception, what's your advice for people who might be concerned that they won't bond with a donor conceived baby?
I think it's very important to talk about bonding and attachments, because you have to attach to these profiles, the donor profiles, before you can use a donor. And I think what is the meaning of bonding? You know, men and women are bonded in a different way, so we must also acknowledge that. It takes a while for men to bond with a child, even if there's no gametes involved or a genetic link that's not involved, because normally a dad will bond with his baby just after it's been born. It's not always happen immediately. It can take up to 6 months, and also that's okay, you know, and telling them don't worry about it, that bonding will take place. Attachments is, for me, it's Bowlby attachment theories. You attach in a certain way with people. There's different forms how you attach, and that is also a process that needed to start for me when you see the profiles of the donors, that you can attach to that donor. For at Wynand, it's for me important that the one that don't have the gametes, you know, if you've been have the male part or the female part where we use the eggs or the sperm donors, it's for me very important that the guys sit with me down and stipulate what they need and what they want from a donor. And then we make a short list for them and we go through the process, and they will know exactly this is a kind of donor that they can use or not. I think in the past sometimes we've been forced, or it was maybe not giving enough time to think it over, and then just use the donor sperm. And I think sometimes we as women think it's easy. We just get a sperm and we fall pregnant. But for a guy, it's very important that you go through that phases of attachments. Otherwise, the marriage will run into troubles, because I know 1 out of 2 of our marriages sometimes is not making it because that bonding is not taking place. So before we do the donor conceive or talk about donor families, of the modern families as we call it, that session is for me a very important session.
Yeah, absolutely. Great that you offer that. And that leads on to the next question, which is around counselling, and it's not just for donor conception, any kind of counselling related to fertility treatment or infertility. What would people expect from counselling, and why do you think it's valuable? What should people want to get out of it?
I think people don't always know what to do and how to do it, because they've been mostly concentrated on those risk factors and anxiety, depression that sometimes they fall into. We use here, you know, we talk a lot about problem solving, some things that you can use, but we use a lot two main therapies, and the one is called narrative therapy, and that's where I always say to patients, you know, I can't take this part out of your life. It's always going to be part of your life, but you can rewrite your story and try to see what's the benefits. It's go back to things that make you happy as well during this phase. So it's documented, write it down and see how we can deal with that negative thoughts. How can we let go of some of these intrusive thoughts as well? So, and make space for time to do that in the morning. Sometimes, you know, even if you only drink a cup of coffee, enjoy that moment that you can let go of some of that negative feelings. The other part that we normally take is where we use it imaginary scripting, and that's also where these people are going through a lot of negative memories and trauma. So I always say to them, write down your own needs and desires and passions. Ask for help. Don't sit there and do it on your own. Ask for help and come and see somebody that can help you. When you distress, focus on how you can self-soothe yourself and learn to say no to things, you know, where there's a lot of friends. I see one of your questions is friends and families.
Yeah.
Some, I call it the invasive families. We get extension families, you know, people is giving so many advice to you and you don't know where to go and which way to start. So I say, learn to say no and take your own time to go through these processes. So in general, we help them to reconstruct and get and concentrate on the other purposes in life as well.
Mm-hmm. Someone actually wrote in just today saying that they lost a friend to their fertility struggle because they didn't respond or react to their friend's pregnancy in the way that their friend had wanted, and so it ended the friendship. Is that something you hear of a lot, where people find it hard to continue relationships and friendships and all sorts of
you know, your friend's not always, that's not going through fertility at all, also don't know which questions to ask. Sometimes you say, let it go. You just relax. You know, all that kind of questions that will happen to you. And that's the wrong things you can say to fertility patients. It's not so easy to let go of these thoughts and all the trauma that you're going through. There's medication that has a huge impact. So sometimes I always say to the patient, put up your own boundaries. So go out and say to your friends, don't ask me when I'm going to have a child or not. Say to them, you know, I struggle. That's it. I will talk about it when I needed to talk about it. So put up the boundaries and come forward. You know, when people hear that you can talk about it and you want to talk when you're ready, then you also take control of your own emotions and things. And then also I said to them, tell them, don't let me, you know, when there's like parties or things, don't invited me and I can say no. Give me the opportunity to control it and say yes or no. So I think it's also important to come forward and say it, get it out there and talk about it, but then control it when you want to talk it and how you want to talk it. And I think that's important for your friends because then they know where they exactly stands with you. And that's for me, you know, value of, you know, still build your or holding on your relationship between your friends as well. Mm-hmm. But sometimes you get people that completely overstep that boundaries, you know, they still with fertility, people, you know, gossip about it and sorts of things. So there is bully as well with fertility. Some people, you know, it's for them a feeling of enjoyment if we see somebody else struggle. So we still get that kind of bully as well. Mm-hmm.
Yeah, and feel the feeling of loneliness as well, that people don't understand how all-consuming it is, and how it's impossible to sort of, not impossible, but hard to enjoy the moment when you're looking ahead, thinking, what if this doesn't happen?
Yeah, that's for sure.
And so, in terms of acceptance, how do people find acceptance or closure, not just closure on having treatment, but closure on each chapter of whatever they're going through with a fertility struggle?
Also try to give them a few guidelines, you know, tools that they can hold on. I always say take responsibility for yourself, you know, hold on, you know, the thing that's important for you. Grieve the loss, you know, is at the stage where you're grieving, let yourself go for it. You know, sometimes when we get bad diagnosis, we deny it or we overreact, we're screaming about it or we quite cross about it. And I said, grieve the process, go into that grieving box, you know, during the day as well, but also try to get out of that box and go to different phases of your life or specific in your day. Gather your strengths, you know, you must know your own virtues and strengths. What is the things that I use when I go through difficult times? So I always ask the person, can you remember something else that was been difficult in your life? What kind of psychological things that you use to get out of it? And it's amazing to see when they write it down, you know, I do have tools. I do have resilience and virtues and strengths, how to get out of that as well. Make a plan for the immediate future. I think that's the one thing for the fertility patients because it's so uncontrolled. You don't know what to expect. So I always said, document it, make a few things, you know, and plans into that framework for you as well. Ask your doctor to give you frameworks that you know exactly what's going to happen next. And when I'm my doctor. Here at Wynand, we got an IVF coordinator that really works with the patients hand by hand, and that make it also easier because they got that plan, you know, they know where they're going. Create something that's special for you. Like in my personal life, I started to watch birds, you know, when I really feel stressed and just watch birds. You know, in South Africa, we have lots of trees and the weather is beautiful. It's something that you can learn, you know, you can also learn yourself or teach yourself, you know, that you can find certain things that a typical mindfulness space go to. And that also gives you a little bit of relief of that stressful or traumatic phase that you're going through. Then with partners, I think we can talk a lot about partners, how you can help each other. You know, guys are more problem solvers, so they try to fix it and then they let go it. So it's different emotional things that we also, you know, women in general feel helplessness, guys more powerless because they can't help their wives sometimes. So I also said, put up a plan there, drink some coffee or plan, we're going to go away for a weekend, but plan it. You have to plan that future for you, or that treatment plan for you. Otherwise, it's not going to happen.
Mm-hmm. Do you think that counselling can be good for couples as well?
Yes, I think it's very important. So at Vainland, we see both the partners, men and women, while they're sitting here. We not only see the women themselves, because we sit them and say to them how men react to certain aspects of fertility. I think the problem for women in general is more, the risk for anxiety is there because they're worried about this dream of them is not going to be fulfilled to be a mother. And then they get obsessed about it. I also been one of the patients, you also been one of them.
Yeah.
So we always put the guys in the hotspot, and they can't have sexual intercourse morning and the night. We think it's easy for them. And I think that part is for them very difficult. There must be a desire arousal phase for them, when it comes to sexual intimacy. So we talk a lot about how the guys handle that. And then sometimes they're withdrawn if it's too much pressure on them. So, and guys also, the language they use when they express their own feelings and thoughts, it's more they use it in a form from object. They use and describe it with, cars or my swimmers. And sometimes that, we miss that specific language they use. We think it's, maybe they make a fun of it, but that's a way of how they express their own feelings as well. So
Exactly,
I think it's
what my husband's like.
Yeah. And I think that's
He
important.
uses sarcasm and humour to cover up the hurt.
Yeah, mostly that. So we dive into that, that they sometimes, it's quite amazing how the guys open up when you also start to talk their language, and they open up that feelings and thoughts about it. And specific when guys, there's a male factor. That's the worst one for a couple, because suddenly the woman even handle that worse compared to the guys, because suddenly they know maybe that's the end of my own dream. Mm-hmm. So there's a lot of fear and anxiety in the relationship at that stage, and guys don't know how to handle it. And sometimes they say just use a donor sperm, just to get their wives pregnant, and then after a month or two, then suddenly they realize what is the impact of not make all the closure and the attachments through that phases.
I think the other thing that when you were mentioning about how men and women can, respond in a different manner, without generalizing, I know that women often do like to get things off their chest and talk. Not everyone, but a lot do. I do. And men can often not want to talk about things or bottle things up. Is that something that you see?
Yeah, I think it's also to explain to you, that grieving can be in different stages, and people can grieve in different forms. Even there's a difference between women, there's also the difference in gender. Men handle things completely different to us. And if you're not let it go, and sometimes see that that's the phase of the stage of grieving that my husband is, and it's okay to be there, and you don't realize it, and they want to have them, or be on the same page as you often hear that they say, my husband thinks about it differently. They're not hearing me. I always sometimes put a session out to them, and I said, acknowledge each other's feelings. So they have to do homework. They can write down all their feelings and thoughts about it on a piece of paper just once a night, and then go to a nice restaurant during the week and just read it to each other. But you're not allowed to discriminate or analyze it, just acknowledge it. That's what fertility is doing to me, and what is fertility doing to myself, and just acknowledge that feelings, and then we can take from there, how we can guide them to solve the problems.
Yeah, absolutely. I think that's sound advice. What about anxiety and depression? And you mentioned risk factors and protecting yourself. What are your thoughts on how people can do that?
Yeah, I was quite lucky and interested in the psychological aspects of the fertility patient. So I was doing women and women and men in a study, and that was before all different kinds of treatment. It's like after the diagnosis of fertility, so it's before the home plan or the ovulation induction plan, and then also we was looking at our patients before the artificial insemination and through IVFs. And in the population of South Africa, it was quite interesting that men was a higher risk for depression, and the women for anxiety. So when they start to do their treatment or on treatment plan, the anxiety is the whole time here. And that's one thing that I learned from it, that you have to manage them and teach them how to manage that anxiety. Guy specific, it was quite surprising for me that a lot of guys in South Africa, struggle with mental health disorders like depression. It could be like in our country, a lot of guys is working for themselves. So the pressure is out there, they have to provide and they work long hours. So that could also lead to a higher risk for depression. But that's something that's not going away. And then what we also see then when they come to the stage of IOIs, they've got completely unrealistic expectations. Mm-hmm. So you think you come here and when there's 10 eggs, there would be 10 embryos, and from that 10 embryos, there's a chance that I would have probably 10 babies. Completely unrealistic expectations. So we talk a lot about the theme of unrealistic expectations. What does it mean? What is metaphasic 1 or 2 eggs? What is mature eggs or not? That not all eggs ended up in mature eggs, and not all eggs are good eggs. So, and the same with the sperm. So we talk a lot about the realistic expectations of our treatment plan and outcome.
I think that's really useful. Thank you. And thank you so much for your knowledge today and expertise and expanding on all these areas. As I mentioned, the team have written a fantastic article all about everything we've discussed and more, and the psychological effects of fertility on people, and thoughts in terms of what you can do to support yourself, and also obviously Finland, how you support your patients. So how can people contact you if they'd like to discuss further or arranging a consult, for example?
No, they can go to our website. It's www.vanelandfertility.co.za. I think a lot of these things is on our website. We also got little videos that explain the emotional roller coaster disease, what to do. So I think there's a lot of information out there. When they feel free to contact us, they're welcome, So we're in South Africa. I also lived in the UK for a year. My English is not the best, but yeah, so we will.
Thank you. And you do see patients from all over, don't you?
Yes, we see from all over the world. So we're quite lucky. I think we also do have the embryoscopes here. So we're the only clinic in South Africa that mostly do embryoscopes. We do single transfers. So yeah, and we've got a big sperm and ovary bank as well, and where we can help building modern families. And as I said, it's for us. It's a passion what we're doing. It's still fantastic, when we can help people, and that baby, holding that baby in the hand, it's a great opportunity to see how people.
Yes. Definitely. Well, we had someone at the beginning saying how wonderful your team are, and for anyone who wants to check out more about these themes and everything that we've discussed today in lots of depth with lots of supportive advice and tips, please head to our link in bio and you can read all about it and contact the team. So thank you so much for your time today, Lizanne.
It's fantastic to talk to you.
Thank you for joining. Have a good evening.
Bye-bye.
Bye.